Good afternoon, and thank you for joining us for the first briefing of the new year. Today, I'm joined by Dr. Kathryn Fiddler, Vice President for Population Health for the Tidal Health Medical System, Dr. Mark Frana, Professor of Biology and member of our University Health team, Dr. Karen Olmsted, our Provost and Chief Academic Officer, and of course, my Chief of Staff, Eli Maudlin, is also here to take and answer your questions. Before we get to the details of our spring COVID-19 protocols, I want to take a few minutes to talk about our employees who have been our heroes during this pandemic. As we've dealt with COVID-19, our incredible staff have maintained the highest level of support and services to Salisbury University, allowing us to remain safe, open, and available to our students in person. Our dedicated faculty have taught and engaged students in ways that were previously unimaginable, ensuring that academic rigor and instructional quality were not lost, even during these unusual times. All of you had your own families and personal matters to attend to, and yet you made sure that our students had the best possible educational experience. Words cannot fully express my gratitude for your incredible work and the sacrifices you've made. Today, I'm happy to share that faculty and staff will receive a bonus in upcoming paychecks. In addition, most full-time employees will receive cost of living adjustments, as well as merit increases as appropriate. And there will be additional cost of living and merit increases in July of this year. HR will be sharing more detailed information about these salary adjustments in a separate announcement. I want to thank Governor Hogan and Chancellor Perman for their support and recognition of the hard work of our employees. Now, to the steps we're taking to fight the pandemic. As you all know, the Omicron variant has spread quickly, and that put enormous pressure on our healthcare workers and systems. Our guiding principles during this pandemic have been to protect lives, to protect jobs, and to protect educational quality. And that includes remaining open, but only if we can do so safely. As the leader of an institution of roughly 10,000 students and employees, I am committed to ensuring that we do not present a burden to our local healthcare infrastructure. Our layered approach, which includes having high vaccination rates, regular testing, mask wearing, in-house contact tracing, and other safety protocols have helped to keep us open and have prevented us from being that burden. And as we've done throughout the pandemic, we're updating our guidance based on the best available information from local, state, and federal public health officials. These experts tell us that the best way to protect ourselves and one another is to get vaccinated and to remain up to date with our vaccinations. And that includes getting a booster when eligible. This is particularly important for congregate and densely populated living, learning, and working environments. We join other University System of Maryland institutions, including the University of Maryland College Park, Towson University, UMBC, and UMES, in recognizing that this is the best way to move forward to keep our campus as safe as possible and continue to provide in-person instruction without presenting an undue burden on our local healthcare system. We're making this announcement in accordance with the updated guidance from the CDC on what it means to be up to date with vaccinations. As was the case last semester, students and employees for whom the vaccine is not appropriate can apply for an exemption on medical or religious grounds. Those who receive exemptions and therefore are unvaccinated or not boosted when eligible are required to test on Tuesdays and Thursdays in order to maintain access to the main campus here in Salisbury. Students and employees at regional higher education centers elsewhere should follow the guidance for that site. I think you all understand how prevalent the virus is right now. So you also understand that this is a path we must take to protect the public health. As we look forward to the start of our spring semester at the end of this month, I'm now going to turn the briefing over to Dr. Kathryn Fiddler from Tidal Health Medical Systems. Kathy, thank you for joining us.
Thank you, Dr. Wight. As the president said, I'm the vice president for population health for Tidal Health. We are the largest healthcare system on Delmarva, including hospitals in Salisbury, Maryland, and Seaford, Delaware, and physician and specialty practices in nearly 30 locations across the shore. TidalHealth Peninsula Regional, like many hospitals across the country, is dealing with staffing shortages and record-setting volumes in our emergency department. Our capacity today is currently at 108%, and over 24% of those admitted are admitted with COVID-19. We recently announced a move to a crisis standard of care, meaning that we have individuals outside the walls of the hospital redeployed to care for our COVID-19 and other patients. Our hospitals need large institutions like Salisbury University to do everything possible to keep the people that they bring to our community safe and out of the hospital. What we've seen since Omicron became the most prevalent variant is that the virus has the ability to evade the initial series of vaccines if a lot of time has passed since that last shot. And as a result, the CDC amended its guidance on staying up to date with vaccines. We need our community to get boosted when they become eligible. Of the 82 patients currently in TidalHealth Peninsula Regional with COVID here in Salisbury, only 3 have received a booster, and presently none of those patients are in our critical care areas. And while it's true that the majority of SU students are in an age group that's healthy and therefore less likely to suffer severe illness, when you introduce more than 8,000 of those individuals into a population and factor in Salisbury University's nearly 2,000 employees, you can see how easily this decision that the university makes can have enormous impact on our ability to provide care to the community. And it's not just COVID admissions or ICU capacity that we're looking at. While SU was on break, we saw an average of 15 COVID-related visits to the emergency department every hour. These are usually otherwise healthy individuals experiencing mild to moderate symptoms of COVID-19 and seeking medical care. You can imagine how the potential exists that this number could jump as we introduce more people who haven't taken every step possible to reduce the severity of potential illness. We applaud SU for consulting with us and for following the science through this pandemic and doing their part to protect the community. And I would like to take this opportunity on behalf of the grateful community to express my appreciation to all our amazing healthcare workers who have been nothing short of incredible throughout this pandemic. I'm now going to turn this over to Dr. Mark Frana.
Thank you, Dr. Fiddler. You've heard about the importance of COVID-19 boosters, but I want to take a few moments to drill down on how the booster adds to your protection, reduces the severity of illness when you do contract the virus, and how the vaccines and booster slow the evolution of new variants, thus helping us to get out of the pandemic more quickly. Studies have shown that for people that are generally healthy, the initial series of the vaccine continues to provide protection against severe illness, even with the Omicron variant. But recent data are showing that staying up to date with your vaccinations and getting a booster substantially increases your protection against COVID-19. That increased immunity means that you are less likely to become infected with the virus, but if you do, you will experience a lower viral load, meaning you will experience less severe illness, you will experience symptoms for a shorter period of time, your infectious period, or the period of time that you can transmit to others, will be shorter, and importantly, the amount of virus that you're able to spread will be decreased. Reduced transmission will result in fewer cases and less quarantine or isolation. Reduced virus production and replication also means less chance for the development of mutations that can lead to new variants. We know that the Omicron variant is highly transmissible, and even though it appears to be less severe when compared to earlier variants, it is still responsible for massive amounts of illness and death, as well as innumerable lost hours in quarantine and isolation. Enhancing our immunity through boosters is extremely important when considering the congregate and densely populated environment of a university campus. Now you're going to hear from our provost.
Thank you, Dr. Frana. We appreciate your continued service on our University Health team. As it's been mentioned, it's our goal to keep our campus safe and open, and we know that students learn better and have more meaningful experiences when they're able to learn in a setting that's appropriate for them and for the course content. For some students, that's virtually, and we're very proud of our online programs and for the way that our faculty shifted to virtual instruction at the start of the pandemic. But we also know for the majority of our students, the best place for them to learn is in person. Face-to-face instruction has been the core of SU's mission to teach and engage students for almost 100 years. And I'm so proud of the way that our faculty have managed and continue to manage over the course of the pandemic with face-to-face instruction. CDC quarantine guidance and the recommendations of our own health team indicate that anyone who's not up to date with their vaccine, which includes getting the booster when eligible, would have to be away from campus or out of the classroom until cleared to return. This guidance is based on current evidence regarding the infectiousness of the virus and its variants. We recognize that without requiring boosters when eligible, we could anticipate even more disruptions to our instructional activities, both for individual students and for the campus as a whole. We want to remain open and in person, and it was clear that these protocols will give us the best chance at doing just that. We do know that some students, as a result of testing positive or through contact tracing, will have to miss class or time in class, and my office will work to ensure that students are properly supported if they're unable to attend class while they are medically not cleared. If students have questions or want to better understand what they should do if they're unable to attend class, they first should consult their syllabus. Next, they should talk to their faculty member. And if they still have questions, they should email provost@salisbury.edu. Now, Eli Maudlin's going to come to the podium to answer some of your questions. Eli?
Thank you, Dr. Olmstead. Before we get to the questions, I want to provide some updates. First, a reminder that all students and employees are encouraged to wear KN95 or N95 face masks while indoors, but they are required to wear them in classrooms and other instructional settings. Everyone will start the semester with a box of 10 free KN95 masks, and starting on Monday, they will be available at the Guerreri Student Union Information Desk for pickup. There's information on the COVID page regarding proper use and storage of these masks. As a result of the federal government providing free at-home tests, SU is no longer able to provide these tests for members of our own campus community. We are encouraging you to visit the Postal Service website to order tests. And certainly if you're experiencing symptoms, please stay home and contact Campus Health and they will help you get tested. Additionally, if you would like to test for another reason, you can go to the website and sign up for a test. If you already have an approved medical or religious exemption from the fall semester, you do not need to apply for a new one for this spring. Regarding the booster and testing, you do not need to participate in twice weekly testing if you are vaccinated but not yet eligible for the booster. Once you get the booster, you no longer have to participate in that twice weekly testing, even if your booster was received past the date of eligibility. And a reminder that all students and employees are required to get a return test. If you are not up to date with your vaccine, that test needs to take place before you get access to campus. If you do receive a medical or religious exemption, you will need to sign up for twice weekly testing by Thursday, January the 27th. Please continue to monitor your emails and other communications for upcoming vaccine and booster clinics. Now to some of the questions that have come in. I will note that a lot of questions have come in, so please make sure to email, stay informed, and wait for response if you do not get an answer to your question here today. The first question is regarding testing. If someone is vaccinated and up to date with their vaccine, so they've received the booster and they get their return test, will they need to test again? Right now, the answer to that is no. Certainly, if you're identified as a close contact, the nurse might tell you to come in for a test, at which point you would need to come in for a test. But as it stands now, once you are vaccinated, up to date with your vaccines, and you've received your return test, you do not need to come in again. This question is about special requirements for housing students. So housing students should absolutely go online and sign up for their test immediately. Housing tests need to happen on the day of move-in. And so those spaces are limited. So housing students should absolutely go online and sign up for their test as soon as possible. How do we, or should we account for the immunity of someone who's already tested positive for COVID-19? I am going to ask Dr. Frana to come up and answer that question for us.
Thank you, Eli. That's a relatively common question. And what we know is that for people who have had COVID-19 or tested positive for COVID-19, they in all likelihood have developed some immunity against the coronavirus. But we also know that that immunity can be quite variable from one individual to another. We also know that the vaccine against COVID-19 specifically targets the spike protein of the virus. And so by getting the vaccine and getting the booster, you're really enhancing your immunity above and beyond what a normal infection would give you against that spike protein. And it's the spike protein that is critical to establishing a virus infection within your cells. If the spike protein can be modified or blocked by an immune response, then it cannot infect your cells. So by getting boosters, even for those individuals who have had a prior infection, getting the booster is only going to increase the likelihood that you're going to be protected against further infection later on.
Thank you, Dr. Frana. Please stay close in case another question like that comes up. This question is about special restrictions for athletics. So certainly athletics is looking at and will release information for amended event capacity. That's going to happen on pretty much a regular basis as things change and the university health team continues to look at the data available. Are there special requirements for student activities? So certainly some student activities will require the KN95 mask based on the setting that they're in, whether they're indoors in a densely populated area. But the best guidance would be for students to check with the sponsoring host of the event to find out specifics about an event. The next question is about online or hybrid courses. Are we staying in person? Should we move online? I'm going to let the provost, Dr. Olmsted, take the question about virtual courses.
Thank you, Eli. Yeah, that's another question that you can anticipate is why don't we just go back all online? And I'm not happy to say it, but this isn't our first rodeo with having to manage coronavirus on campus. After a couple of semesters of this, we have a pretty good sense. And after nearly 100 years of instructing students of what works well. And for many of our courses, that in-person component where students are connecting with their faculty members inside and outside of the classroom, connecting to each other, taking advantage of all the resources on campus, including those outside of academic affairs, whether it's students affairs or all our support services. We know, and we have, I think, pretty good data that's really the best way for us to serve many of our students, not all of our students, but many of our students. So for students who are medically cleared to come to campus and are registered for in-person courses, we're looking forward to seeing you here and to helping you out if you should test positive or be identified through a contact tracing process.
Thank you, Dr. Olmsted. This question is about exemptions. Can exemptions be submitted if someone did not have a medical or religious exemption in the fall? And the answer to that is yes. Students and employees can continue to submit exemptions. This question is about the difference between SU's policies on isolation and quarantine as compared to those of the CDC, the Centers for Disease Control. So the president has mentioned this, as did some of the other guests today, that SU is following the policy set forth by the university health team. And one of the things that they look at is the congregate living, learning, and working environment that we have, the densely populated environment that we have on this university campus. And sometimes our days of quarantine or isolation will be a bit longer than the lowest available from the CDC. So we're following that guidance to keep campus as safe as possible. And that's based on decisions by the university health team. The next question is about an off-ramp. Will there be an off-ramp for our testing policies, for our masking policies, and other COVID-19 precautions? And as a representative of the health team, I'm going to ask Dr. Frana to take that one as well.
Thank you, Eli. So the university health team has been meeting on a regular basis throughout this pandemic, and we will continue to do so and monitor things in terms of positivity rates, et cetera, extensively. We continually consult with the CDC guidelines and look at those guidelines. We also look at the most recent literature that's available on what we understand about this particular virus transmission, et cetera. And we are going to continue to follow those guidelines. So be assured that the health committee, there are several members on the committee, we try to keep on top of the latest science concerning this particular virus, and that's what we're going to follow. So any modifications to protocol will be based upon the best scientific evidence.
Thank you, Dr. Frana. This question is, will extra K95 masks be sent to each school for students who forget to wear one to class? So each academic unit does have a supply of K95 masks available, and faculty, students, or staff in those areas only need to reach out to the dean's office to get those masks if someone forgets a mask, breaks a mask, et cetera. And then I will note that campus will receive an email when they can come and pick up masks in addition to the 10 that were given at the start of the semester. There will be an additional allotment later on in the spring. There are a lot of questions that came in. I'm going to end the questions there and ask that any additional questions be sent to stayinformed@salisbury.edu, and we will make sure to get to them. That'll conclude this week's briefing, and thank you for tuning in.